Well, hello, everybody. It is April 8th, 2025. This is Dr. Ellithorpe. I'm here at Tustin Longevity Center, and we come every Tuesday at 6 o'clock in the evening till 7 o'clock. Here we take any question you have from a functional medicine, medical question. We're trying to look at things from a preventive functional medicine, integrative medicine response, and trying to do things as natural as possible. I'm a medically trained doctor, family practice, and have practiced for 44 years. We all work here trying to do preventative work using bioidentical hormones, natural supplements, IV, high dose vitamin C, chelation, things like this. And we've been doing this for many decades. So we have a lot of experience. When we answer questions, these are not meant to be personal recommendations for any individual patient asking or person asking the question. This is not personal medical advice. This is how we would generally address a certain symptom complex and try and approach it from a functional point of view. So, with that said, there's two ways that you can get a hold of us. Today we have questions. I have a few from last week that I didn't get to. And if you go on to tlcdoctors.com, tlcdoctors.com, that's plural doctors, you can get onto our newsletter and then you'll get a notification of this. And when you get the notification, there'll be a link where you can type up a short, brief question that you may have. And then we'll do our best to try and answer that. And then the other way is we have the live chat here on the YouTube. So if you're a member of YouTube and you can log in and then go to our live chat. And I try to answer the live questions first for those who are actually sitting and listening to me live. And it looks like we have some live people already logging in. So welcome. If this is a benefit to you and you are helped with this, you want to share it with friends or family, please like and subscribe and share it with your family and friends. So the first live question we have is from Jennifer. And Jennifer says she put finger in my ear a week ago, dumb, causing pain and hearing clog. The emergency room doctor saw that wax was building up and a possible infection. So he flushed it and the pain went away. Apparently, he must have given her oxyfloxacin eardrops because she asked the question, why do oxyfloxacin drops make ear feel worse? Is it safe for me to fly? Well, I haven't seen your ear. I don't know what it looks like. I don't know if there was a perforation from when he washed it. The oxyfloxacin is a fluoroquinone. I don't like fluoride-based prescriptions. They have some side effects. You may be having a side effect from this being put into your ear. So you have to, if it's the pain has come back, but the hearing is not clogged anymore, you have to have another doctor look in your ear to see what's going on, because you shouldn't be having pain come back after using the prescription antibiotic that the emergency room doctor gave you. So I would have it checked, and I would certainly do that before flying. Because if you have an issue with your ear membrane, maybe the pressure of rinsing it created a tiny tear that has opened up, because oxyfloxacin is a DNA replication inhibitor. And if your ear membrane is trying to heal, I'm not saying it was ruptured, but it could. That's one of the risks of doing an ear flush. I used to be an ER doctor for many years. And then you're taking a medicine that, inhibits replication of DNA when your own cell membranes are trying to heal there. That could be a problem. But anyway, please have it rechecked if you're in pain and have someone take a look at that, because the pain shouldn't be coming back. Okay, Jennifer? The next live question is from Debbie. Debbie S. Hi. She says, Dr. Rita, hello. How long does it take before the vitamin C from enhanced chelation is completely out of your system? Thanks so much. I would say about 6 hours, something like that. Yeah, it's short lived. If you do a finger prick for blood, um, ascorbic acid looks molecularly almost identical to glucose. And so it is eaten up or taken up by your cells very quickly. And this is one of the reasons why we like it so much, especially in cancer, because high dose vitamin C in a deranged, rapidly growing cancer cell cannot handle the natural antioxidant effect of vitamin C. It doesn't have a certain enzyme catalase to quiet down the presence of vitamin C's oxidative stress it puts on the cell. All your other healthy cells have plenty amount of this enzyme. And so that's what helps to make it toxic for, I guess, every cell line in vitro that they've studied with high dose vitamin C has actually killed in testing the cancer cell line. So it's taken up very rapidly because it looks like glucose. So 6 hours would be the latest I'd ever expected. That's why you don't want to prick your finger if you're a diabetic. You don't want to test your blood for at least 6 hours after a vitamin C infusion because that will falsely make it look like your blood sugar is high when it's not high at all. It's just the vitamin C. And then Perry on the live question says, what exactly is ozone therapy? Where is it useful? Dental, IV? The answer is yes and yes. It's very useful because oxygen is a very important antioxidant that healthy cells know how to handle, and bacteria, fungi, and viruses don't do well around it. So ozone is making like extra dense oxygen where you can use that gas and you could put it in a root canal. You can inject it there. You could put it intravenously in a solution called ozonation of the blood. Some of us, and we have here the ultraviolet light where we reperfuse your blood after we put ozone in the blood, and then we let that blood come back into the body, passing it through ultraviolet light, and it really cleans your blood beautifully. So it's an antibacterial, antifungal, antiviral. I guess there's going to be those who say it's anti-cancer, and I would agree with that. So it is a powerful oxygen therapy that is destructive, really, to all noxious forms of, bugs, bacteria, things like that, even parasites. So hopefully that explains it to you. Let's go to our first question. I missed this last time. John said, I guess there's so many fat-soluble vitamin receptors available in the body. So if we flood them with vitamin D, which is a fat-soluble vitamin, there may not be more room left for other fat-soluble vitamins. How far off is this thinking? John, I would say this is a bit two-dimensional because we are 40 trillion cells, and at least, okay? And we have, not only are we composed of structurally probably 40 trillion cells, but we have this whole community of cells lining our gut, this living biome that forms in our gastrointestinal system is active and very vibrant, bioactive. So even on your regular 40 trillion cells, so there it would be almost very difficult to overdose with vitamin D. I have never seen vitamin A, vitamin K2, any vitamin, fat soluble vitamin disrupted by giving doses of vitamin D, even as 50,000 a day for many days in a row. So I think it's because we are living things, and docking on the cell membrane is almost like an instantaneous, uh, fraction of a second. So, no, I don't think that's possible. Patsy says, a friend recommended orthomolecular sinotrol for my constant sinus problems. Do you take it every day or just when you're having a problem? I used the silver argentin daily for over a year now, but it doesn't help much. Well, no, I don't use the Sinutrol. I use what is called seasonal shield, which is DHIST, capital D as in dog dash HIST, which acts as a antihistamine for my very bad allergies. So I use DHIST, or what we call seasonal shield, and I take 400 to 600 milligrams a day of this quercetin-based product. Now, there's quercetin in Sinutrol also. So Sinutrol has that. It has some herbs that act as, you might say vasoconstrictors, astringents. It has in it, Sinutrol has N-acetylcysteine in it. It has some enzymes. I think it has bromelain in it. And the amount of milligrams is not enough for me. So I take N-acetylcysteine about 1,000, 1,500 milligrams a day. Sinutrol combined in all three capsules has only 750. Sinutrol only has, I think, 200 milligrams of bromelain in it. And I must take systemic enzyme wise, especially if I feel congested, I'm taking 5 times that amount. So what I'm trying to point out is this Sinutrol is good as a safe, natural decongestant antihistamine. But since I have bad allergies, I need something stronger. So I'll go and take separately my systemic enzymes, and I'll take 5 on an empty stomach, first thing in the morning, last thing at night. And then as soon as my pressure congestion is improved, then I'll drop it off to once a day. Then I take my enzymes. Well, I talked about the enzymes. I mean, N-acetylcysteine, NAC. And each of my NAC capsules is 500 milligrams alone. So if I take 2 to 4, I'm way higher than you'll see in the Sinutrol. And then the quercetin that I take is in the DHIS, and there's 200 milligrams per capsule. I think you get a total of 200 in 3 capsules of the Sinutrol because they put so many other things in it. Long and the short is, I use my nutrient replacement therapy on a much higher dosing level on individual targeting things rather than adding in a little herb here and there. I don't do it like that. I just take the mucolytic effect of my iodine tablet, and acetylcysteine helps with mucolytic effect. And my enzymes help break up mucus and inflammation, and my quercetin acts as a natural mast cell, allergy cell stabilizer. So I go, that's how I handle it, Patsy. And I will use the Argentine silver if I get dried eyes in the winter, which is getting wet now. So now I'm getting exposure to all the pollens and the molds. And I use the Argentine now to prevent a secondary bacterial viral overgrowth from congestion. So that's kind of how I do it. George says, hello, can you tell me why my fasted glucose of 95 can go up to 145 immediately after riding the Peloton 30-minute bike at a zone 3? Do I have that much glycogen stored? What is the best way to exercise to decrease glucose levels? I eat about 100 carbs a day, but like to have yogurt, honey, and almonds at 7 p.m. after dinner. I'm 51. George, that's too much, and that's not going to get you long-term health. to have a fasting blood sugar of 95 is too high, just to start with. And your habit of eating later, like 7 p.m., with those snacks of yogurt, honey, and almonds, that's going to only add to the sugar metabolism problem. I know we're born into a world that has almost anything you want available all the time. And, we just have to apply self discipline to say, what are my goals? What do I want to be able to do when I'm 70? I'm in my 70s now. You're 51. So you could be my son. And I'm saying, you have to realize that these ranges that are on the lab sheets that say you're in the normal range are a lie. And your doctor is not telling you the truth. You have to get that fasting blood sugar down to 85 or less. And you have to understand, yes, the stress, the adrenaline surge of the stress, plus cortisol stress, all these hormone impacts of working out on the Peloton bike is going to mobilize your fight or flight sugar for the event of the exercise. Okay. So, George, please put this discipline to yourself. You can have yogurt, almond, and honey earlier in the day and maybe just on Sundays. It's not like you can't have any of these wonderful things we can afford today. It's just we're too commonly using them over and over and over again. Okay, they're too available. All right. If I did a test, I would want a fasting insulin on you. And I bet you'd be in what the world calls a normal range. But I'm telling you that you are insulin resistant already just because your fasting blood sugar is 95. I bet you, because I've seen decades worth of people's labs. And that's all. I'm here all the time. Yeah, year in, decade out, decade after decade. I'm here all the time. No vacations, no going away, doing anything. And what do I see? People with blood sugars of 95 fasting, they typically have a fasting insulin of at least 5, if not higher, 8, 9. And the HOMA IR, they've created a actual equation that I've been personally practicing through good advice from astute observation of my patients and not depending on some stupid sheet of reference ranges. And I was able to say, boy, anyone with blood sugars above 85 and insulin fasting above 4 is going to have insulin resistance. And they're on their way to their slow chronic metabolic disease. Pick your choice: Alzheimer's, heart disease, diabetes, cancer, whatever it's going to be. So better you hear it now. Go ahead and get angry at me, but I will be the one who's told you the truth. All right, Sherry says, let's see, we have a live coming in. So live from Cynthia. Hello, and thank you for taking our questions. Okay. May God continue to bless you. Well, thank you. I appreciate the prayers. I believe in God. I have a world view of Christianity. Okay. So she goes on to say, my dear friend has been diagnosed with stage 4 breast cancer. She is taking ivermectin and fenbendazole along with conventional chemo. She is on a carnivore diet. What else should she be doing? She is 61 years old and a strong believer. Thank you. May God continue to bless you. Well, I'm I have a general theme that I tell all my cancer patients. Number one, I'm not the oncologist, so discuss with your oncologist whatever you're doing. But what I recommend is a theme that has borne fruit and gets people. I have a large percentage of people that see me who have oncologists managing their cancer at various stages. And the wonderful thing is, rarely do they pass on. Okay, that's so incredible. I'm blessed of the Lord to have had some of the longest lived glioblastoma multiforme patients. I mean, normally that's a diagnosis of a brain tumor that will take you out in a year and a half. I have patients who are, 8, 9, 10 years, 5 years past that diagnosis. So we're so thankful. And what do we do? Well, we put them on enzymes, high dose enzymes. Like I told you, I was taking 5 twice a day, our systemic enzymes to help chew up the debris. I have them all do high dose vitamin C, at least 50 grams twice a week minimum. 3 times a week is even better, but twice a week is good. And that with EDTA chelation therapy to open up the circulation. Even ozone therapy will help oxygenate it. And remember, you starve the cancer by eating as a carnivore, and then never eat if you at all possibly can. Stop eating around 3 o'clock in the afternoon. You can begin eating, at 6 in the morning when you wake up, and eat like a carnivore. And then take iodine. Iodine is a very powerful, you could look up YouTubes on David Brownstein. David Brownstein is another family practice doctor who got caught up in studying iodine and the deficiency and the great need we have for it. About 96% of all Americans are deficient, but your regular doctors don't even know that. And it's very much associated in preventing breast cancer, ovarian and uterine and prostate cancer. It's very much associated with mental acuity. It's very much associated with high performance and good performance of thyroid metabolism. So your immune system is blessed with it. I would be on high dose vitamin D therapy. I would be taking vitamin D3 with K2, at least 10,000 international units of vitamin D with K2, at least 90 micrograms in a combination capsule. And I would use 1 odd, 2 even. Then I would have your local doctor try and find a good functional doctor, test these levels of your vitamin D. And any level that is around 100 micrograms per deciliter is wonderful and protective. I would also try and get a good night's sleep. I would wake up early in the morning, get my feet in the wet grass of the earth so I get some earthing grounding done. I would let the infrared light from the sun rising in the morning penetrate my through my clothes and all my body for at least 2-3 minutes. If not, take a walk after you put your shoes back on. If you ground for 2 minutes, that's all you need. And then you can go take a walk, because exercising your muscles and doing some resistance training is also an anti-cancer thing where you're doing resistance training. Then I would take a wonderful multi-mineral chelated, Albion chelated minerals, like we have TLC multi-min, to get the selenium level up. Selenium is very powerful as an anti-cancer, zinc-rich multi-mineral. There's many other things in it. And then I would use quercetin. I would use 600 milligrams of quercetin. So I would get Seasonal Shield. That's our quercetin, but it's also called Dehist by Orthomolecular. I would take 3 capsules. Quercetin has anti-cancer benefits. Berberine also has anti-cancer benefits. These are the things that I would do. And find yourself a good functional doctor. Let your oncologist know what you're doing, and may the Lord bless you. All right. Cynthia, all right. Christina says, "Hi, Dr. Rita. My 5-year-old grinds his teeth while sleeping. Should I be concerned? I don't know how to stop it. Thank you." Yeah, I would talk with the dentist about that. He doesn't have all his permanent teeth, and I'm not a dentist, so I don't know all the facts, but there are some mouth guards. Find out his blood type. Get the electrical influence out of his room. Parents are putting in so many monitors in their kids' rooms and imaging things. This is stressful for the brain and not relaxing. It sounds like he might be benefited by going on Juice Plus with some magnesium. The powdered magnesium called OptiMag Neuro is relaxing to the muscles. Might help him sleep better. Make sure he's not watching those videos, but talk to your dentist on that. And she went on to say he doesn't have any health issues. I'm starting a homestead and have animals. I have read that goat meat is healthier than beef. What is your recommended meat choices for daily meals? Well, probably the best uh, one that I'm practically and functionally studying and clinically testing is beef, grass fed only. Beef liver is even superior, beef heart. So I'm in favor of, nose to tail consumption of the animal. But any grass fed source, whether it's the lamb or it's goat or it's poultry or it's pork or the beef or even fish that are wild caught. These are very, very valuable. Um, so that's what I recommend. And I don't recommend eating late. All right. Dolores says, hi, Dr. Rita. Was rear ended Wednesday night and Friday morning. I woke up with temporal mandibular joint TMJ symptoms. Yesterday, my doctor prescribed anti inflammatory. I usually take 5 vasculozyme in the morning. Should I increase or any other suggestions? Well, micro damage from the jolt creates tiny little micro tears throughout your whole body. Like I fell walking my dog and I really injured my wrist and my right shoulder where I landed and my right knee and my left foot, just I really took a toss onto the hard sidewalk. So I'm taking my Vitalzyme 5 twice a day, maybe even 3 times a day. Um, and I'm drinking extra water. Of course, I like to drink my Analemma wand water, but then any filtered water, but structured water. If you could look up the YouTube, uh, Dr. Pollack, Pollack, electrically structured water. That is a mind blowing one. So plenty of water. You could fast for 24 hours. That disinflames immediately. But I would use the enzymes at least twice a day. And uh, if you could, don't eat past 3 o'clock when you do eat, and eat really mostly protein. I'm taking extra what you call perfect aminos because I want to heal up my shoulder and my muscles and everything. I did go and lift weights on Monday and worked out. I'll do it again tomorrow. So I didn't give myself any space to cry me a river of tears for my pains. And I did a very good job working out on Monday. The body needs this, so I keep this range of motion, and I don't baby my joint. Uh, of course, if it's persistent, you have to go back to your doctor and see them. I don't like nonsteroidal anti-inflammatories. I don't certainly want to support the beast, the pharmaceutical medical monstrosity that we've created. When I have severe pain, the worst that I can and I can't handle, I'll just take an over-the-counter Motrin, 200 milligrams ibuprofen, uh, 2 or 3, and then give it a few hours, and then drink a lot of water and fast. So if I'm taking Motrin, I am pretty much taking it on an empty stomach. I will down some oil so it isn't on an empty stomach. You shouldn't take nonsteroidal anti-inflammatories without food, but that's what I would do. All right, and well, you might also, Dolores, take extra magnesium. Magnesium glycinate is very nice for relaxing the muscles. So you might do that. The mathematician. Okay. Hey, I have an important question. Can you please answer? Can you please answer? Well, I don't see the question. So I can't answer because I don't have the question. All right. Just type in the question, mathematician. Okay. Dolores went on to add, we'll start PT, physical therapy, not sure what they will suggest. Thank you for your advice. God bless you. Thank you, Dolores. Um, good. Exercise is very important. Range of motion. So I'm very happy to hear you're exercising. So let's see, how far did I get on these? I am on. Okay, Shiri. Sherry said, I'm a longtime patient of TLC, and I've noticed I haven't been sleeping as well as I used to. I'm 65 years old, and my progesterone level is 24.6. That's a great level. Estradiol is 60. That's okay, but maybe I would try and get it to 120, especially if you want to be more mellow and sleep deeper. Testosterone level is 45. Mine's 170 on my 50 milligram a day DHEA. So I need that extra for my muscle mass. But I'm a bigger woman. But I could see you going up on that. Should I raise my progesterone levels for better sleep? Well, we have tried that. I think your level is good at 26. I'm more thinking that the estradiol should go up. But again, you would have to call the office and let us see your chart and see what estradiol you're on and what form you're taking your progesterone in, because I don't know who you are. And you would have to have your doctor here, or if it's me, I have to look at it and then make a suggestion from there. But we have taken progesterone levels up to 800 milligrams to really help someone sleep well. Sometimes we've used high doses like that to get relief from migraines. We've done that as well. So, but I suspect it's the estradiol that's not good enough. Okay, she said, I don't eat past 3. Don't drink alcohol. That'll mess up your sleep. And maybe get the electronics shut off in your room and your phone away from you. Crystal says, hi, Dr. Rita. What are your thoughts on red light therapy? Well, I love it because infrared, red light therapies are the light of life. And I have a infrared in my bedroom that I can a tent. It's called Sauna Space. Sauna Space, and it's a little tent, and it has 4 big lights in it. Infrared heats up. My body temperature gets up to 101. I'm usually in there for 40 minutes, and I'm listening to a lecture or something. That's why it's 40 minutes. And then it just really stimulates and helps energize my whole body. So just like infrared in the morning, when I stand out with my bare feet in the grass and I let the sun infrared get to me, yeah, I'm all in favor of it. She says also, Krista says, also, I am 56 and noticing the wrinkle effect of aging and was wondering your advice on how to lessen the effect of aging, i.e. wrinkles on my face. Thank you very much. Well, Krista, I put my estradiol on my face because estradiol helps with collagen elastin, and it helps with, trying to stop the crows and all the, the age line. So I'm in my early 70s, and I would just point out to you, that's part of it. Now, good antioxidant, I'm going to also say the Juice Plus antioxidant that I take now almost for 30 years has reduced the rate of my cell death, the amount of wonderful water I drink, the amount of exercise I do to incorporate my collagen. When I'm eating all the meat is important. So I eat a largely carnivore-like diet, a lot of, beef, chicken, eggs, bacon, sausage, fish, pork, all those things. So I would use estradiol cream on my face. And I put it on every day of my life. That's how I do it. Let's see, what else? The next one is Charisse. Charisse says she had a full thyroid removal. Her thyroid stimulating hormone last check was 8.5. Before the thyroid was taken out, it was a 1.67. It's been about a year and 3 months, she said, and she just started taking T3 medication with levothyroxine. She's scared of the side effects. Is there something else I can take to help T4 conversion in the body? She's a diabetic with high blood pressure, cholesterol, and has reflux. Well, yeah, iodine and selenium would be very important. The TLC multi-minerals have the selenium in it and other valuable things, and then the iodoral will greatly help with your thyroid function. But with the other problems that you have, one of the important things is you've got to find out your blood type. You might need digestive enzymes at your age. How old did you say you were? You didn't say how old you were. But find out your blood type and see if you can even absorb your minerals like selenium and so forth. And then work on a low carb diet. Don't eat late. Please don't eat past 5 or 6. Drink enough water and exercise. Do weight training. And that'll do a lot to get rid of many of your problems down. Susie says, hello, Dr. E. I would like to know your thoughts on a carnivore diet and putting epilepsy in remission. Wonderful. It's one of the greatest ways of doing it. And back in the 1950s, I think it was some of the first formalized studies on the carnivore diet on epileptic children, ketone producing carnivore diet. Now they're looking at variations. There are some products over the counter that are ketone powders that you can put in water to help keep the ketones. See, the brain is a machine just like every cell in your body, and the engine will fire appropriately or it'll sputter and backfire. And we believe the sputter and backfire on the brain connections is a result of poor metabolism from the pollutions and the high carbs in our diet. Nevertheless, a ketone is such a tiny molecule, and it's so easily absorbed, even compared to glucose, and the brain prefers ketones to calm those neurotransmitter engines down so they don't sputter. The ketones are a fabulous way to do it. So you might do a carnivore keto, very low keto, low carnivore diet, low carb diet, plus take the powdered forms of ketones, okay? And that would be very valuable and helpful. And yes, we've seen that help people, especially children, but also adults. Brian says, good evening, Dr. Ellithorpe. I'm taking the following supplements: systemic enzymes, digestive enzymes, thyroxine, that's a thyroid support, and it has a little bit of glandular thyroid in it. Energy Core, the D3K2, and Seasonal Shield, that's rich in quercetin. I do not take them all at the same time. 3 of the supplements have vitamin C, 2 have vitamin A and vitamin D and zinc. Should I be concerned that I'm getting too much of a certain vitamin? No, we've thoroughly vetted all these. And if you're taking them as directed, it's not going to be a problem. So that should be fine, Brian. And then it looks like we're getting some more questions here. Oh, so mathematician put his question out. Hello, doctor. I am a high scroller and I don't get proper sleep. The one thing I noticed was there will be some liquid stuff released from my pens. From that day, I font get proper sleep. I'm a high school student. I've noticed that when I sleep deeply, I sometimes have. Okay, so this would be some questions that you need to share with your doctor. Okay, I don't want to talk about some of these things on the open airways here. So if you're interested, you can find a functional doctor at acam.org, acam.org. You could call our office and get depending on where you live, 714-544-1521. But those kind of questions that you're bringing up, I don't want to discuss openly. All right, let's go to the next question we have here is Mary. Mary says, what is the best salt for flavoring? Everyone is arguing about the nitpicky minutia of everything today. But in general, kosher salt and diamond salt, diamond as in the diamond ring, diamond salt, kosher salt, these are very large rock things and have very little contaminants in it that would, give an edge on the flavoring. What is the most nutritional? I suppose it would be good to say probably Celtic salt. Celtic salt has more trace minerals. I don't know about any studies on rock salt or diamond salt. But as far as flavoring and giving you the salt without all the contaminants, that's what I would recommend, Mary. Joanna says, "Hi, Dr. E. My 28-year-old daughter has a complex cyst on her right ovary, 13.5 centimeters, I guess, volume with normal vascular flow. Can you recommend ways of treating it naturally? It causes pain in her hip going down to her kneecap before her cycle. She also has a simple cyst on her left ovary, 10.5 volume, 2.3. These are large cysts. I think you should be talking to your OBGYN doctor. And when you say the term complex cysts, that puts in a higher risk for it becoming more concerning for developing other problems. So I don't think I would look for enzymes and progesterone and a low carb diet and lots of water and exercise. I would get rid of those cysts and probably elect to have surgical removal. And, even I had a simple cyst when I was 18 or maybe 19. My husband was on active duty in the military. We were at Fort Campbell in Kentucky, the 101 military. My husband was a military policeman, and we had no money. We were renting the top of a old house in the center of Clarksville. It's been demolished already, but it was a proper slave built, just bricks. It was just a beautiful place. A retired teacher rented it to us just for interest, and it was only $62.75 or 50 cents that we paid every 2 weeks when he got a paycheck. And I had no phone. We had no money. We would go walk by toll booths to pick up dimes and nickels and quarters. We were so poor. But so we didn't have a phone. And I felt something rupture in my abdomen. I felt sudden pain and a faint feeling. And I fainted and I laid on the floor all day. I was laying on the floor. I crawled down the stairs from the top of the uh, place we're living because it wasn't set up with shut doors. She interviewed us. She trusted us to be, God fearing and not steal. I crawled down her stairs. She wasn't there. And I got on the phone and I was so stupid. I was 18 and I called Fort Campbell ER, and I talked to someone, the nurse, and I was saying, I think something's wrong. I didn't know what happened to me, but I said, I can't move and I feel faint. And hung up. I used her phone. And then I crawled back up the stairs and I just laid on the floor until my husband came home. And then he found me, and of course, he rushed me in. And I had ruptured a cyst and bled quite a bit into my abdomen. So thank God it wasn't anything worse. And I had surgery immediately. And I would not play around with this. I would address it. And these are large cysts. So I would go to your OBGYN and address it. Joanna also says, what are the benefits of taking systemic enzymes? Is there evidence that systemic enzymes shrink cysts? Well, the answer is yes. And I've had many a patient over the 40 years who had much smaller cysts. Any cyst that's above 5 centimeters, especially if it's complex, has an increased risk for becoming cancerous. So when I see these young ladies, I'm very aggressive with 3-4 centimeter, and I'm telling them to use their progesterone, the low carb diet, exercise, not eat late, drink plenty of water, and take their enzymes 5 to 8 twice a day. And many times they greatly improve with this. So is there study? No, maybe now we'll finally get some money with this corruption taken out of our tax money wasted in Congress. And we'll get this to do this research because I work every day, bam, 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 and I don't have a collator, although I do have electronic. I have volumes of patients over the decades and decades of all these natural ways of healing people. But I don't have the time to pull each one up. but maybe someone could do that for me. Maybe AI will do that for me. Okay, Andre says, what's the best thing to do for very dry skin on the face, including eyelids and neck? Should I use a certain cream, lotion, change the diet? Andre, find out what your blood type is. If you're an A, you're not digesting fats as well. If you're taking a shower once a day or twice a day and soaping up, you're rinsing away all your oils and your skin is getting wet and cracked, wet and cracked, wet and cracked. So find out your blood type. If you're A, you need digestive enzyme to help digest your fats and proteins. That'll help your skin. And then don't shower as often. This is all marketing pressure. I only shower once or twice a month, and I do sponge bathing all the other times because it's only your pits, under your arms and your groin and your feet that have bacteria that can generate odor. So learn to use sponge bathing like that. And if you have to shower, please do a military 3-minute in and out shower with just as cold water as you can handle, and only put the soap to your armpits and your groin and your feet. And that will help your dry skin. Then the oil that I use, I put my hormones on my face, find out, where are you at in age? Are you in menopause? Because that'll accelerate the drying up and the failure to heal your skin. So hormones, and I put mine on my face all the time. And I keep my estradiol, high enough so that I have all this thickness of my skin. This is another where I fell. But the backs of my hands don't look like old lady hands so much because I keep the estradiol rolling, rolling over me. Let's see. I think we have another. No, we don't have another one. The next one would be Andre. Andre asks, no, that was the one about the dry skin. Lisa, my healthy 24-year-old son is pursuing a career as a commercial pilot. I've recently heard about the large amount of pilots who get cancer due to the radiation exposure. What can we do to minimize the impact of exposure he will likely face? Well, I was a flight surgeon, and so I know the answer to this completely. He has to work with a functional doctor. I would do EDTA chelation to pull out the lead and the cadmium and the nickel that's in all this JP4 jet fuel. So he needs to get chelation periodically, high dose vitamin C, which will act as an antioxidant. He should take Juice Plus all the time, and he should be well hydrated. Find out his blood type. If he's A, he needs digestive enzymes so he can have enough fat, because when you're flying, 30, 40,000 feet in that airplane, you are going to be hit with this gamma radiation, and each flight is like getting a chest x-ray. And if they have 5, 10, 20,000 hours, they're at risk of higher episodes of Parkinson's and other neurodegenerative disease. But if they do these things, take Juice Plus, eat a rich, high carnivore type diet, find out their blood type, if they need the digestive enzyme, if they're blood type A, to do that, do some EDTA chelation, high dose vitamin C, take the D, take the K2 with it. That's also fat soluble. Get on the multi minerals. The healing will be great, and have these rules about intermittent fasting, because if he's going to do commercial flights through international time zones, he's going to have to understand about jet lag. And jet lag is associated with melatonin sequencing from the pineal gland. Wherever it's 9 o'clock at night, he has to learn how to care for getting extra melatonin so he can go to sleep and adjust for this. So we did all these studies in the 1980s. Yeah. So I did my thesis as a flight surgeon on antioxidant protection for my Air Force fighter pilots, for the vibrational helicopter injuries. I was doing all kinds of research on the pilots. So yeah, we can keep them healthy. Get Juice Plus. And then let's see. The next thing is Linda says, can you describe in simple terms how carcinoembryonic antigen, CEA, tests for cancer. Does it just check inflammation? Are there other cancer finding tests? Thank you. Well, yeah, there are other antigens. These are protein fragments, you might say, that come off of certain types of tumor tissue. Now, carcinoembryonic antigen, CEA, is a type of protein fragment that you see richly during pregnancy, okay? With a newborn baby, the rapid growing birth for a child. But then it drops off immediately after the delivery. When tumors are growing, they mimic many of the behaviors of pregnancy in a sense. And there's this whole theory, and I've gone over this before, it's called um, trophoblastic theory of cancer, trophoblastic theory of cancer by Professor John Beard. This was published in 1909. It's been long since known. Then Otto Warburg comes along. So the oxygen deprivation at the point where that little ball of cells has to get into the uterine lining to make the vessels that go to make the placenta is a critical point because the oxygen and waste requirements are starting to not be achieved through just diffusion in the original little lump of cells that the human being is. And so that burst of growth into the uterine lining and development of a placenta could be called cancer. And there is a cancer of pregnancy where this doesn't stop. And this type of chorion embryonic carcinoma can just keep on growing and could be but this is extremely rare. But anytime areas of your body don't get oxygen, that's why I love EDTA chelation so much. It improves microcirculation. It gets in the high dose vitamin C. It gets those trace minerals and selenium and zinc into the tissues deeply. That's why I like exercise. That's why I like water. That's why I like a low carb diet, so you don't gum up your little capillaries and choke off your little cells. And then, because deep in the memory of the DNA of that cell and every cell in your body is the memory of what you were like as a 1, 2-celled, 4-celled, 8, 16, 30, 32 celled onto 64, 128 cells. Okay. So carcinoembryonic antigen is testing for that kind of a fragment. Smokers who have hypoxia often have minute elevations of this. That's why, it's a wonderful way to scare people to stop smoking is to do a CEA reading and saying, hey, you're trying to trigger something going on with your little cells being choked out of good oxygen. And so that hopefully that'll explain it to you. Nori says, what are your thoughts on iridology, dark field microscopy, or live cell analysis? Thank you. Well, it is kind of like Saturday Night Live. It's not quite ready for prime time. I did a doctorate in functional medicine, integrative, alternative, complementary medicine. So I got a doctorate in it in 1999 to 2001. So over that time, I studied this. I have a dark field microscopy myself, but I don't need it. You really, we're straining at a gnat and letting a camel pass through the eye of a needle. Look you can drink your water and reduce your risk of disease. You can be on a low carb diet and diabetes and reduce your risk for hypertension and heart disease and cancer with a low carb diet. You can exercise. You can try and get a good night's sleep, ground, and you can eat rich protein to help repair yourself. I mean, these are the things we need to be talking about, not exotic testing. I need good doctors who know how to practice medicine and get that relationship with the patient focused on what really matters. So that's what I think of it. And, iridology, yes, I studied that. We went through it and I understand the link. I understand the meridians in the body and acupuncture and the energy flow dynamics. And this is all valuable. I'm not saying it's not. But we are seeing as much corruption in alternative medicine as we have been seeing in standard of care medicine. And that is, you get a little bit of knowledge, and then you think you know everything, and you're going to say, as an iridologist, do this because I see this ring on your iris here, and it means a toxic level of a metal or liver or whatever, and they sell something. Now, I think maybe many are well-meaning, uh, but we have to understand, you have to get good doctors raised up that will study and study and study to be able to answer and answer and answer all these questions, and be there like a mom in the kitchen at the house. The kids go and run around, but they know mom and dad are there, and they're going to get their reference point. They're going to get their follow up, and they know their mom and dad are always thinking for the best for them. And that's what a real doctor should be. All right. You can send that message to JFK Jr., to the Department of HHS, and call 202-224-3121 and tell them I know how to fix medicine. You need doctors who love their patients and see them as the great creation of God that they are, not evolved out of a pond of scum evolution. All right. Vicky says there is a lot of internet talk wearing organic underwear and ditching polyester. I agree. There is. Does regular cotton, non-organic, when washed, wash out pesticides or toxins from the fabric? Should all our clothing be organic? Is it time to ditch Lululemon products? You know, Lululemon, I think, is a spandex kind of skinwear for exercise. The answer is yes. These synthetics, plasticizers, microplastics, these chemicals are just not right. And so, yeah, we need to wear cotton and linen and normal things like that. Again, do they wash out? Well, how about we get rid of all these pesticides, herbicides, and fungicides and just grow it normal? Then John says, the TAC2 trial study of 2024 claimed no evidence of cardiac benefit from the EDTA IV chelation. I suspect you could cite opposing studies. At least I hope so. Well, John, the answer is yes, but they're not funded, so you're going to be stuck with an old doctor like me. What they found is that we had been arguing for many decades, and we were part of getting lead out of gas back in 1992. So we have fought. I fought in the military to get a better type of non-knocking metal additive to the gas to help the combustion of the petrochemicals in the engines. That especially when you're in a fighter jet, you don't want to have knocking, you know, and your engine's going kablunk up in the sky. So I think there are ways to enjoy technology, but teach the doctors how to keep up with environmental toxins. And so what we found is, as soon as we started getting lead, even though it's already contaminated the crust of the earth all over, the excessive aerosolized lead is reduced. So the person who went into TAC2 is a lower lead level damage at risk and cadmium level at risk person. And remember, EDTA functions to greatly reduce the oxidative stress of these divalent toxic metals like, you know, aluminum and lead and cadmium and so forth. So they didn't know back in the 1990s when they were starting this, planned this study on the original Tech Trial 1 to measure their lead level. But they did by the time they got to Tech Trial 2. The difference is those that did have, because some of the doctors do test it, and they had an average lead level of, I think, 17 or 18. The lead level today in the same age person with the same disease, diabetes and heart disease, has an average level of about 9, half that. So the dramatic improvement as far as the secondary effects of diabetes on the cardiovasculature were not as dramatic. it certainly did show a tremendous drop of their lead levels. Even from the 9, they went down to a 3 lead level. So it's a valuable treatment. So you have to look at confounding factors like what is the diabetic of the 90s compared to the diabetic of 2020, okay, who went through COVID and junked up on all that food because this went right through that homebound lockup eating dynamic. And so I'm going to say they aren't equal studies. Yes, they use the same IV perfusion of EDTA 40 chelations over the course of a year. But I think the patients are different. Some of the toxins are not as dramatic. There are other toxins that are not being accounted for, but still there was the nice reduction in the heavy metal toxins. And we know these are cardiotoxic lead and cardiotoxic cadmium. And we want to say there are many other toxins too that are removed, like aluminum and mercury, that EDTA will remove. And so it's a valuable treatment. So hopefully that helps you. All right, so we're at 7:01. My throat is sore. I've been working all day long, and so I need to stop. I've been up since 5 and I'm feeling pooped out. So I am going to say good night and God bless. And if this is a blessing to you, please like and subscribe. Share it with your family and friends. I'll be back here next week at 2 o'clock to ask the doctor anything and try and get to the last 5 questions. So I did a better job this time. Okay. All right. You take care. God bless.